Hi, I'm Suzy Cohen, a real-life pharmacist offering real-life solutions. And today's question comes from Lou from Tulsa, Oklahoma. And he writes, Dear Pharmacist, I've been on painkillers for years because of an auto accident, and I read in a recent column that the oxycodone I take is a drug mugger for melatonin. Please tell me what melatonin does and if I should supplement. I'm so glad you wrote to me. Melatonin is depleted by certain painkillers in the body. It's what I call the drug mugging effect, and I talk about this in chapter 24 of my book, The 24-Hour Pharmacist. Melatonin is very important. Without it, you won't sleep well. In fact, your own brain makes melatonin in response to darkness. So when it gets dark outside, or you turn out the lights in your bedroom, melatonin is naturally secreted from your pineal gland in your brain. It's sort of like the master clock of the brain. And when drugs mug it, then you may not be sleeping as well as you should. Although with painkillers, you're probably feeling better and you do need to take them. I'm not saying to stop your painkillers. I am suggesting that if you take any kind of opiate like oxycodone or hydrocodone, also benzodiazepine drugs like alprazolam, which is Xanax, or clonazepam, which is Klonopin, or any of those like Valium, that's another one, Ativan, anything like that. Those are all drug muggers for melatonin. And here it is. These are just a couple of brands that I had. You want to take this about 1 hour before you go to bed, and it takes about 4 to 6 weeks before you really start to get the full benefits. And it's absolutely fantastic if you don't take these drugs and you just want to sleep better. As we age, melatonin levels decline. So that can be a problem, especially for the elderly that are dealing with other conditions. So I think melatonin is a great supplement. It should be okay to take with your other sleeping medications, but do check with your doctor, make sure that that's all right, and start at the lowest effective dose.
How much melatonin should I take?
Good question. There's a lot of debate in the industry about how much melatonin is enough. And so you'll see dosages varying from 0.3 milligrams all the way on up to like 6 milligrams. Now, if you're someone that has cluster headaches, those are the kinds of headaches that you get that wake you up in the middle of the night and it feels like somebody's like jamming an ice pick into your eye. They're usually one-sided. Then I would say take a lot of melatonin, because studies have shown that like 6 milligrams could help with those sorts of conditions. Again, clear that with your doctor. This does act like a hormone. If you have multiple sclerosis, again, you want to take higher doses. Or breast cancer, there are some studies that show melatonin works fantastic and helps prevent certain cancers. But if you're just like a regular person or you have a drug mugging effect, I would say stick to around 1 milligram and see if that works. If the dosage isn't helping you after a month, then go on up. And I hope that helps you. That's your tip for today, and I'll see you next time.